Welcome to the Ortho Joke Podcast, a joint production of the Journal of Bone and Joint Surgery and OrthoEvidence. Join hosts Mohit Bhandari and Marc Swankowski as they discuss current topics and publications in the world of orthopedics and beyond.
Well, hey, Marc, how are you? Good morning. Welcome to another great episode of Ortho Joe. How are you doing?
Yeah, I'm good. It's amazing. We've been doing this for, I think, 5 years now.
Gosh. Yeah.
That's and there are people still listening, which it just shocks me that we haven't turned everybody off that once tuned into this. But here we are again, and we both got a cup of Joe. So I'm still sticking with my Boston Journal roots.
And today's the one day where I didn't do my Tim Hortons run. So I have local in-house, which is fine. But, I wish I had my cup to, just nice to have sports against your Dunkin' Donuts, a little Canadian versus the U.S.
Yeah, it's a little bit like the NHL battle cross-border, I mean.
Right. Today is an interesting day. We're going to take a look back at some studies that, for each of us kind of struck a chord with us for a host of reasons. And I believe also that we chose from a shorter list of papers that have generally been very well cited within the Journal of Bone and Joint Surgery. So we had a relative short list of many, many thousands of papers that we looked at. And from that, I'm actually quite curious, what your top one or two papers were. And I suspect that there's many we could have chosen. So this is more just about things that probably resonate with things that are interesting to you, I'm sure, and a few things that are interesting to me. So I'm happy to go first, or I'll let you go ahead, Marc. I don't know if you have.
Well, let me just give Christina Nelson all the credit, because when we've done these in years past, she's kindly pulled the list of the most downloaded articles off the website, which is the fodder for this discussion. And thank you, Christina, for doing that. And I'll just kick it off. There was a highly viewed article on postoperative weight bearing after ankle fracture fixation, which has been a topic that's been kicked around the last decade or so. There's a large trial out of the Metric Consortium led by Bill Abramsky, recently published, and many cohort studies that looked at it's safe. And what was, I think, unique about this, it was a very well done trial, but they did not exclude any types of ankle injuries. So syndesmosis injuries were included, posterior malleolar fixation was included, et cetera, et cetera. And it turns out that the risk of losing reduction and failure of fixation is almost nil with early weight-bearing instructions to the patient. So I think this particular trial may be one that will finally, answer along with the other previously done research, that it is safe and efficacious to allow patients to bear weight, with some perhaps obvious caveats about patients with Charcot disease that are diabetics, et cetera. So a very, very important and well done trial. And I congratulate the authors. And, at the journal, we always try to publish the things that are going to change practice. And I think this is one that's done that. So it was fairly recently published.
Yeah, and I think you're right too, Marc. It's always hard to think about, okay, what's going to actually move the needle? And, we've done a lot of work at MAC on the idea, what does it mean to be creative, and what's it mean to be creative in research, and what's a creative idea? And it's got to be novel, but it also has to have a use. It has to have some use case at the end of it. To your point, how do you measure impact? You measure impact, I think, on will people change their practice based on these findings? Your assertion is that people will change practice based on these, or at least the evidence is there now to consider changing practice based on this paper. Yeah.
Yes.
So
absolutely.
So I think that's really important. And because it's not just a single isolated trial, it's a trial that comes on the, with a massive, history of people exploring this question to various degrees, whether it's observational studies, smaller trials, and ultimately doing a slightly larger trial that ultimately helps you and consolidates that, I think is the way to go. So yeah, for me, it's interesting that sometimes it's these, questions we think about all day. You see them in the clinic, right? And you just, you make your decisions based on that individual. But overall, it sounds like it's a really well designed paper. I, on the other hand, had a very slightly different choice, and it had to do with the paper that, and I'll give you the storyline here. It says JBJS, it was in JBJS in October 15th of the 2025, and it was home call and sleep in orthopedic surgeon. So, everyone has this perception that, well, if you're at home, it's a little bit better, and it's, you can do more call if you're at home than if you're in-house, because in-house is going to be far more. I don't think the argument was that in-house is better than being at home, but the question is, what's the impact on sleep of being at home? So they put, I guess, there's a Whoop straps on that kind of measure kind of your biorhythms and sleep. So they had 16 orthopedic attending surgeons and 14 surgery residents for a period of about 13 months, wear this diagnostic tools, basically. Bottom line is, they found that, as you might expect, on average, orthopedic surgeons sleep less than their residents. Orthopedic surgeons, on average, I think the number here was about 6 hours on average across the year, and residents were 6.7. So not a huge difference, but 6 versus 7 hours or so, basically. Now, when you're on home call, though, residents' sleep decreased by 20%. So it was a pretty significant decrease over that period of time. And it really wasn't like any sort of call to action. It was just like, hey, let's just be aware that sleep is really important, and that, we're not sleeping as much. I guess my broader question to you is, 6 hours, that's pretty accurate? Is that enough? Is that too much for some? The one thing I will start off with is Time Magazine back in, 2023, said there are 4 things you need to be happy. They had these happiness experts, and they said 7 hours sleep is what you need. That's what they said. You got to have a hobby. We had numerous podcasts. We're talking about people's hobbies. Got to get outside of the house, and you got to meet people outside of the house. Those are the kind of 4 things that led to a general sense of happiness. But focusing on the sleep, is there some magic around 7 hours that you think is factual?
No, I really don't think there's a mean that every individual needs to work towards. We've all known people that require more sleep and people that require less, and it has to do in large measure with many variables like age, physical activity, diet, the use of alcohol, et cetera, et cetera, et cetera. So I think it's a reasonable number to start with for a discussion, but I don't think it matters to the individual. And my question for the investigators would have been, when comparing the attendings to the residents, it would be, did they control for age? Because I think there is a argument to be made that as you age, you actually may require more sleep to function well than in your youth. And that certainly is our experience as trainees, right? I mean, on average, what the work environment gives us when we're trainees is less. And a lot of that has to do with anxiety that somebody's going to call us up with a clinical problem or a surgical problem that we're not sure we can deal with. And then, of course, as we age, we get more confidence and experience, and that bit of anxiety dissipates significantly. So a long answer, but I think it's variable depending on age, stage of career, and those other things I discussed.
Right. And I think the one thing that you can always add to this is, what is the impact of not getting enough sleep? Because I'm sure if the average is going to be days there was much less than days there was maybe a little bit more against the standard deviation, and correlate that over those 13 months as to, just mistakes, right? However you want to quantify mistakes, and, cognitive decline as a result of lack of sleep in that next 24-hour period. So there's some of those things that I think really can get answered and need to be answered, but still, it was a highly referenced paper in the journal for a whole bunch of reasons, and I suspect it probably has some political ramifications. But I think people are generally curious, right? What's happening, and trying to understand that. So it was a topic of high interest, it seemed, this past year.
Yeah, the other one I would bring our attention to is highly downloaded and reviewed was the issue of alignment guides in total knee arthroplasty, the gap-based versus the overall alignment based of the femur and tibia. and no essential difference. And it just comes to mind what the continued number of submissions in regards to the influence of robotics on total knee alignment that we've seen at the journal. Many articles that have shown that improved alignment with robotics, and the whole nationwide push, I would say, towards every major hospital and most individual, particularly mid and early career surgeons, being trained in robotics. And I just had a knee replaced a year ago by a highly skilled colleague of mine, and he didn't use any robotics. And man, am I happy I had it done. So I think we're going to continue to see these types of submissions regarding what's the real role of the advanced alignment techniques of robotics versus the other two, gap-based and overall alignment-based. And I don't know where it's going to come out. It seems to me, as a non-arthroplasty surgeon, that the best argument for the use of robotics is the 5 to 7% of patients that really have bad alignment to start with, to get the components in right to create the solution you want. Because, most of the evidence we have to date is that it doesn't really provide any short or long-term advantage for the patients that are, within the 90% of patients receiving knee arthroplasty. But boy, if you got a really deformed leg, really ambulatory deformed leg, it will be really nice to be skilled with the technology. And to me, that's the best article. I don't know what you, or pardon me, the best argument. I don't know what you think about that.
Yeah, I mean, I guess I'm speaking clearly as not as a clinical expert in arthroplasty, but I would say the idea of tools. So however we look at it, right? Alignment tools, and we're looking at robotics now, but it's going to evolve. It's going to continue to evolve. And I think there's a lot of, every company has basically invested heavily in this perception that, robotics are going to become the future. And that's going to be really an interesting dynamic, for the years to come. And I think really what's going to help us a lot is research that really helps us understand the impact beyond the initial alignment, beyond the initial accuracy of putting an implant in. What is the longer term impact? And, when people say, well, this makes the X-ray look better, or it's a tangible improvement in how, the implant goes in. But, at the end of the day, there's no difference between, if it's human-based versus a robotic, focused. The truth may be, in other words, robotics may be, in fact, a great advantage in this area, but it may also be that surgeons are saying, well, the knee is a little bit more forgiving, or the hip is more forgiving, for example, and that, the body, a lot, like the same thing we used to always talk about in trauma, right? How much of a step is actually going to lead to a particular difference? And you would, multiple times we'd say, people can argue about a millimeter here and there for perfection, but the longer term outcomes don't necessarily, the patient doesn't notice those differences, the extra time and energy. So that, I think, is going to be the debate, but we're not going to figure it out until we actually get those studies, I think, Mark, that actually revolve around those questions that are longer term outcomes following any of these technologies.
So you're talking about the 20-year outcomes is what we
at least outcomes that give some idea of what is the impact on patient function, patient important outcomes, whatever that may be. And I guess you're right in the longer term revision rates, etc. That's going to be important. Now that still may not obviate the need for having other adjunctive technologies. It's just a matter of we got to be honest about the data we're collecting on that. Similarly, which was interesting to me, you wonder why certain papers get let's say that weren't published in the last year, but there's a paper on cementless versus cemented total knee arthroplasty, and there was the midterm results of a prospective randomized trial of about 141 patients. And at 6 years, basically, they found that there was no difference between cementless and cemented TKA of the same design in terms of survivorship, clinical, and radiographic outcomes. Okay, fair enough. That's it's a smallish trial. You don't know if there really is a difference or not. It's midterm outcomes. This was published in June of 2023, but ranked very, very high in 2025 in terms of people being interested in that. And I think that also gets to the point of when you have a trial or an important study design, people will continue to refer back to it. And those cycles of interest, as things advance, become really, really important. And that led me to kind of think, well, that's in 2023. What's the updated, version of that? Is it still the same? Like, is that answer the answer? And with AI now, it's pretty easy, Mark, to be able to go ahead and, do these searches. This is this is the Ortho Joe, so it's the journal in Ortho Evidence. And
Yeah.
I thought, what I could do is just share with you a little output we got from a chatbot that is it's looking only at the Ortho Evidence database of about 14,000 randomized trials. So we're not looking anywhere else. And we kind of look at the data set as the data set because it's randomized trial data. And so I typed it in, and if I can just for 1 second just share with you the output. So for those of you who are listening, I'll be sure to explain what we're seeing here. But you just see here, Mark, hopefully you can see this. I'll just give you the one slide here. But if you look here, we just type it in, should you perform a total knee arthroplasty with or without cement? So kind of a standard question.
Yeah.
And it's amazing now how quickly large language, if you push out to a large language models to say, make sense of the papers we give you. So, an OE basically says, okay, we're going to go based on that topic, we're going to search, and you see a number of papers on the right-hand side. But those are actual papers from numerous journals that come up in about 10 seconds or so. And it was interesting that the nuance it gave. So this will be for comments. This will be for those who are far more expert than you and I on total knee arthroplasty. But they said, yep, both cemented and cementless total knee arthroplasty provide broadly comparable clinical outcomes and implant survivorship, and just makes sense to the paper we just read about. But it did give a little caveat. Cementless fixation can be a valid alternative and may offer modest advantages in pain, range of motion, and radiographic findings in younger patients. But choice would then be individualized based on patient factors, implant design, and surgical experience. Interesting how quickly you can get a narrative, and then he goes into some more detailed. But the reason I'm talking about this, not so much is about what Ortho Evidence is doing, but just about what we're likely to see, Mark, in terms of what's happening in AI. And it used to be that you would search and then you would look through a bunch of papers, as you did. You said you looked at this in Journal Club the other night. This one of the papers. Everything's changing. It's at your fingertips. So Journal Club will become much more dynamic in that someone may look at a paper and say, well, let me just see what's going on, and you'll have multiple people doing immediate, real-time, either validation of whatever someone is presenting, because they're going to be able to get insight so quickly. The question is going to be, what do you trust? And I think that's going to be the challenge we all face. But I found that particularly interesting for one reason, for a couple of reasons. One, it was a randomized trial, so they do hold the test of time. And number two, a paper published a couple of years ago actually was trending to be one of the top papers read and referenced in 2025, which tells you about when advances come, how papers within a journal can start really being pushed up.
Yeah, very interesting. Can I just ask, for the sake of our audience, a technical question? So in the summary, sure, which you put up after doing the search real time, it said that the uncemented technique may have an advantage in younger patients.
Yes.
Is that sentence based on data, or could that be based on discussion portions of these randomized controlled published manuscripts?
Yeah, that's a great point. Because I can only speak to what we do at Ortho Evidence. At Ortho Evidence, because we don't send the whole paper to the large language model. We have our own summary. So what we do is we have our own summary extracted, which looks at really much the data, and then we interpret the data. And so we don't have big discussion sections in our reports. Okay. They're meant to be 700 words or less. So that is coming likely and almost invariably from the results of a study. But you can see that when it says may, it's almost invariably going to be a very modest impact. And you can see there was nothing about functional outcomes. It was all about it looks better. The radiographs look better, and it doesn't seem to be any complications early on. Things like that, which is actually pretty consistent. Yeah, and the challenge we face when we do ChatGPT, for example, you get a hallucinated references that don't exist, etc. But here you can actually click the reference, and you can go to the actual report, and then you can go from that to the original journal. And if you have access to the journal, you can go ahead and download it. So you've got to find a way for people to be able to genuinely look at a summary with the references, click the reference, and see where they got it from, rather than just hope that AI is telling me the truth. And I think that's going to be where we're going to have to evolve to. And I think the skeptics are going to need that type of information. So we hope to launch this again early next year. But I thought it was interesting because we're just doing pilot testing. This just was a good example of that for me. So
yeah, and it's a really important differentiation to assure a reader that it is based on data, not on an analysis of language from published manuscripts. Very, very important. And well, oftentimes, Christina will ask us, do we wish to predict what's going to be hot in the orthopedic world in the coming 2026? And we both agree that AI is going to be a topic of great interest and hopefully more education of our reading audience as to what to pay attention to, what sources, what engines, et cetera, et cetera. Do you have specific plans to do? You started doing focus issues with the journal this year, which I think everybody agrees is a great advance. Do you have a plan to do regular updates on AI in our field, Mo?
It's almost like I planted the question, Mark, but no,
we didn't. I assure you.
No, yeah.
Our preparation for these podcasts are zero. So
yeah, you're giving away all our secret sauce, which is none. No, but I would say to you, it's exactly true. So we have a theme issue planned for AI in the new year, and I believe it's almost in its final forms now. So as you know,
good.
Now, the challenge we always face in something that's so rapidly evolving is to stay as current as we possibly can. So we hope to bring this out earlier in the year than later. But who knows? There'll be multiple changes and edits over the year to concepts that are evolving, and we'll be sure to try to stay on top of that as much as we can. But it used to be, right? It used to be, Mark. People would ask, what were you doing, in early March of 2020. That was kind of, the predecessor to March 11th, where the whole world got shut down with COVID. Yeah. Now the question I ask to audiences, and it's funny, they look at me funny, but it works because I show them the data, which is, what were you doing before November 2022? Let me ask you that. What were you doing? And people will say, well, November 2022. And then you say, well, actually, end of November 22 was when the first ChatGPT was released. And most of us thought, I don't know what the heck this is. And I thought it was some sort of joke. And then within 4 months, there were 1.9 billion users in 4 months. It took over the world that quickly. And it's never, it's just out. It's out. So now it's just now a race. It's a race to, the world is racing to figure out, how quickly to evolve to super intelligence. And so we'll see how 2026 goes. But I think we're going to see exponential changes from 2025 in AI.
Well, I'm sure that's an accurate prediction, no doubt, Mo. And it'll be interesting to see where we end up, hopefully with some balance, because right now the enthusiasm seems to be far outweighing the caution. So
100% agree. There's a quote, actually, I can leave us with if you want. And
please.
I reflect on it. There was a Nobel. I'm going to look.
Is it from Wayne's World?
I wish. But that's a classic. That that or Dumb and Dumber. They're both classics, both Oscar winning for me. But anyways, it was a Nobel Prize in physics in 2012, and they said creativity belongs to humanity, not to machines. This is in 2012. So there was some foreshadowing there. So I do think for us to remain human is to be as creative as possible and continue to push that forward.
Way to end it, Mo.
All righty. Have yourself a lovely end of the year, Mark, and then we'll be back, I'm sure, soon enough with lots and lots of stuff for the new year.
That'd be great. Looking forward to it. Cheers, Mo.
All right. Take care.
Yeah.